Hi guys, welcome to my presentation for this genetics class. All semester I have been looking into cystic fibrosis. So what is cystic fibrosis? Cystic fibrosis is an inherited genetic disorder that affects the lungs and the digestive system. Thick mucus, shown here, actually clogs the lungs and affects how one breathes, and it can actually cause infection as well. So here's how a normal lung and airway should look, and then here's a person affected with cystic fibrosis and how their lung looks. The history of cystic fibrosis. This disorder was first discovered in 1938 by Dorothy Anderson. She performed autopsies on children who were believed to be malnourished and discovered cystic fibrosis of the pancreas. Around 1948, Dr. Paul Sanangis discovered that infants with CF were having high salt contents in their sweat. So about 50 years after cystic fibrosis was discovered by Dorothy Anderson, they linked the CFTR gene mutation with cystic fibrosis. Prevalence of CF. It's mostly prevalent in Caucasians. Every 1 in 2,500 Caucasian newborns are born with CF. The disorder is much less in minorities such as African Americans and Asians. In African Americans, it's about in 1 in 17,000 newborns, and then in Asians, it's about 1 in every 31,000. So it's significantly less common in minorities. Characteristics and symptoms of cystic fibrosis. A patient with cystic fibrosis can experience respiratory and digestive problems. So respiratory problems can include inflammation in the lungs, which can cause troubles breathing, wheezing, coughing, lung infections. With cystic fibrosis, thick mucus starts to build up in the pancreas, and in the pancreas, the enzymes are helping digest food. So when these enzymes aren't being made enough, it's going to be hard to digest food properly, which could lead to abdominal pains, diarrhea, constipation. Also, with cystic fibrosis, the CFTR gene inhibits the regulation of electrolytes in a person's system. So a person with CF could get really dehydrated, and that's why it's so common for high salt contents to be in sweat with people with cystic fibrosis. The cause of it is a mutation of the CFTR gene, which is found on chromosome 7. Inheritance pattern. CFTR gene mutation is inherited through an autosomal recessive pattern. Each parent who has cystic fibrosis carries 1 copy of the mutated gene, and when each parent gives 1 copy to their offspring, the offspring then receives that cystic fibrosis. So a good example is my pedigree chart here. So Eric and Carol both are carriers for cystic fibrosis. Their chance of having offspring with cystic fibrosis is 1 in 4. So as you can see, Chris here does not have cystic fibrosis but is a carrier. Lonnie does have cystic fibrosis, and Matt does have cystic fibrosis. So Lonnie marries Mark, who's also a carrier. So their chance is 1/2 of having offspring who has cystic fibrosis. Matt and Amber, on the other hand, are the same way. They have a 1/2 chance of obtaining their offspring obtaining cystic fibrosis as well. Now, Kennedy and Chris here, they both are carriers, so they have a 1/4 chance, just like Eric and Carol, of getting offspring who has a genetic disorder, cystic fibrosis. So testing for cystic fibrosis, genetic testing is available and it normally happens in newborn screenings. They test for this CFTR gene mutation. If an adult is showing symptoms of CF, a sweat chloride test can be performed, and then genetic testing. Genetic testing is done normally at birth, so that's pretty important to know. Early detection is very important with people with newborns and cystic fibrosis. Most newborns are screened for it during their newborn screening, which is mandatory in the United States. Making sure they have good nutrition and their parents know how to better care for their child with CF improves the longevity of the child's life, helps them grow, and overall their health improves if it's detected early. Sweat chloride tests can cost about $250. That's much less than a genetic test, and that costs around $3,000. So if a patient doesn't have insurance, it's very, very, very costly to get that genetic testing done. The controversy with genetic testing, there is big controversy with newborn screenings and genetic testing. In genetic tests, they test for different genetic disorders in newborns, and each state is kind of different, so they test for different things, but cystic fibrosis is one of those main tests that they run. The problem with this is that they're debating on whether it should be mandatory or voluntary for the parent to allow for genetic testing with their newborn. They can test for genetic disorders, but there's not really a set in stone treatment for these disorders that they're running. But it's good to know, I think, early on, so then you can try to see how to manage it better as the child grows and gets older and everything. So, how to live with CF. The best way to prevent complications and infections is to avoid germs, making sure we wash our hands, and staying away from sick people. If a person's sneezing or coughing or anything like that, it's best to stay away to prevent infection. And here are my references. And that's all I have for you. Thank you.